Hi, welcome to Live with JSC. I'm Carrye Hodges. I'm a nurse practitioner here at the Jemsek Specialty Clinic. Dr. Jemsek and I just wanted to spend some time with you all today just talking about Lyme borreliosis complex as it relates to COVID-19. So just some housekeeping things. What we're going to do is go over some questions that were submitted earlier in the week and kind of talk through those. Feel free to submit additional questions live. And if we don't get to your questions today, we may have additional podcasts or live streams in the future, so we may address them then. Other than that, Dr. Jemsek is here with me today, and he is the perfect person to speak with because he is infectious disease board certified. He has worked with the AIDS epidemic for 20 years and now Lyme disease for almost 20 years. It is also his birthday, so this is the biggest birthday party he's ever had, so also wish him a happy birthday as well.
Thank you, Carrie. First of all, I want to show everybody we're social distancing. Here we go.
6 feet apart.
Right. Very happy to do this. I'm a dinosaur being drugged into the social media age, but I think this is going to be fun, and I want to thank Carrie. It was her idea to do this, and I know some people want to hear from me, and I'm very happy to oblige. Our goal is to make things understandable to the extent that we can, and to reassure you. I know anxiety and stress is a major element in all of this. It's, when humans don't do well with uncertainty, especially if it goes on for weeks and weeks. And our patients with Lyme borreliosis are at more risk because they have more limbic irritability and they can't really, their prefrontal cortex can't wrap that brain around it and rationalize what's happening. I understand that. As far as the clinic is concerned, we're fully operational. We are diminished in terms of number of employees just because our patient load is down. We're mostly doing telemedicine, but we're still seeing patients on site. They wear masks. We wipe down everything before and after, very clean. A lot of us are wearing masks and gloves, and I'm very proud of the techniques that we use. I feel that we're very safe. On the other hand, we're not a COVID screening clinic. That wouldn't be fair to the employees. But obviously, I have to know about this epidemic, and so do my fellow practitioners, and we do know a lot about it. And our mantra has always been to be very creative and out of the box in a safe way. So you could call it a safe box, if you like. And take care of our patients. We're not going to let our patients suffer, and we need to, but we are treating them primarily by phone and instructing them on the proper path to take. So it's my birthday, and I'm not going to say how old I am, but I will give you a clue. The numbers, the single-digit numbers of my two-number age add up to 8. And so you can go from there, but I'm sure most of you will guess 44. And you would be wrong, but I'm sure that's what you're going to guess. GLA project, which was announced last September, has been on hold because of the COVID pandemic. And unfortunately, in general, the COVID pandemic has overshadowed some of the gains we're making in Lyme borreliosis. When this is all said and done, Lyme borreliosis will remain a massive million person involved, families involved pandemic of its own. So it's unfortunate that COVID is there's a hysteria about it that's really taken over. It's real. It's being dealt with. It's changed our whole life. But so has Lyme borreliosis in a different way. And we're still committed to doing Lyme borreliosis. So I want to answer some questions today that you submitted about Lyme borreliosis and COVID or Lyme borreliosis alone to the extent that I can. I'll listen. If I don't know something, I'll tell you I don't know. I'll be very honest about it. And the GLA study, I think, is such an honor and so important. I think we're going to get started in June. Everything's locked and cocked and ready to go. It's just we need the patient inflow. And we're still getting patients from outside coming in as new patients, by the way. It's just a smaller number. In our building, which is a um, comprised of many different specialties in healthcare. We have 36 units. I believe 30 have closed. And so I'm determined to stay open and by every means possible and serve our patients. So Carrye, do you have anything else to add to that?
No, I think that's all the stuff we wanted to update on. So we can jump into the questions. Again, feel free to submit any live questions. We're going to be going through questions that have been submitted over the past week. And if we don't get to your question today, we would like to maybe do this again, another live stream, and answer more questions down the road. So our first question, which was a very popular question, does having chronic Lyme increase your risk with COVID?
Thank you. It's all about the immune system, guys. Depends where you are. People with advanced life-altering borreliosis, Lyme borreliosis, are immunocompromised. And we see the numbers, and we see people getting zoster and all those kinds of things that are inappropriate happen with the AIDS population as well. So one of the things the GLA study will help monitor immune markers, immunologic numbers in terms of the quantity of T cells, B cells, different types of T cells. But trust me, those are down, antibodies are down, and this stuff's not widely reported, and it's really rather scandalous that we haven't done more with that on the immunologic side. So that's why our study with GLA is so important. It's just an observational starting study, but we're working with 3 universities who are going to measure these sorts of things, the inflammatory markers and so forth. If you've been through our program, which takes about a year, and in which we mostly treat with oral programs in pulsed progressive way, we see clinical gains. We see changes in the exam. We see improvement in gait, in balance, in strength, in all sorts of ways. It's really incredible and very gratifying. But we still think you need a couple of years to heal because the damage is so extensive. And after all, we're talking about the nervous system trying to regenerate, and that takes a lot of energy to rewire and do that sort of thing. And certain parts of the brain regenerate better than others. But we're so gratified by the progress we see. And in other words, we see a timeline where you've not had treatment with us, you're in early treatment with us, you're far along, and it all depends. So COVID, to the extent that it's going to infect you, it will make a huge difference where you are immunologically. Because as we go along with therapy, usually several days a month, in combination progressions, pulsing and so forth, as we go along, the better you do, the less we do. We have certain targets and objectives with each phase of therapy. And it takes a while, but it doesn't take forever.
And kind of following up on that question, what are some things that Lyme patients can do to kind of lower their risk as it relates to COVID?
So there may be there are immune modulating molecules out there in the Chinese medicine and maybe other places, but I believe they create chaos and can create more inflammation. It's always a dance between the immune system, which is very confused but angry early on, making noise but not controlling anything, and the amount of pathogens that you have, the range of pathogens, and there are multiple pathogens. We've had this mantra since the beginning that, hey, Borrelia is bad, but it requires these co-infections, particularly Babesia. So we target the main co-infections early on. We always treat the spirochete, which has various life forms. We give our patients downtime so they can detox. But even before we start, we go through a month or two education and change in life patterns so that your inflammation is down. That's a long-winded way to say that the lower the inflammatory state in your body, to which you're very susceptible because you have damaged neural tracts, damaged tissues. So it's your threshold for inflammation and firing off and being unhappy is much lower than the average person. But in any event, the lower your inflammatory quotient, the better your immune system can recover.
And are there certain supplements or things people can do while they're quarantined at home to kind of help lower their inflammation?
So we were going to develop some safe supplements. The market's gone wild in the last few years because people are seeking relief, right? But some of the safe supplements that are being advocated, I'll just go with the CDC's basic recommendations. That would be zinc, at 75 milligrams a day. That would be vitamin C. I like more than they recommend. I like a couple of grams twice a day. If you take too much vitamin C, you have a little diarrhea. Quercetin was a molecule we use with or without bromelain, which is a pineapple digestive enzyme, which has anti-inflammatory properties. Quercetin actually inhibits one of the pro-inflammatory cytokines and is an antihistamine. So quercetin is very good, and I think I forgot one of the other basics. What did I forget?
Vitamin C.
Oh, vitamin C.
Yeah, we talked about that.
And vitamin D. Be careful with vitamin D. We're all deficient, and it has to do with chronic inflammatory stress. 25 hydroxy is what's measured, but 125 is the active metabolite, and it's much more quantities. I used to think that vitamin D in huge levels, 90, 100 mics, so forth, was really good, but in reading about it and thinking about it carefully, I believe that becomes pro-inflammatory in itself. But you want to be in the normal range, which is 30 to 40 to 50. If you're in the 40-ish range, I think that's great. That may take 5,000 units, may take 10,000 units. You'll have to. That's one test that you really should monitor.
And then also, what are your thoughts in terms of like emotional stress or anxiety kind of lowering your immune function overall?
Well, that was one of my starting statements, 100%. So this is an individual choice. If you are spiritual or religious, it's time to have faith and understand that you have free will, but you don't dictate what's going to happen to you. You just do the best you can. I think it's wonderful to employ other techniques that reduce stress, but especially when you're cooped up. Those would include light exercise, meditation perhaps, supplements we talked about, learning new techniques about various modalities, learning new words, learning phrases in a foreign language. That helps the brain, by the way. Getting proper sleep, doing either passive or active detox, trying to sweat. So either a salt tub, sauna, or maybe light toning, or maybe you can get outside and take a brisk walk. You need balance more than ever now, and the enemy is stress. Anxiety is a worthless trait. Anxiety is something that needs to be dealt with, and again, your threshold for anxiety is unfortunately lower, just because of what's happened to the brain. Now, if you're our patient, we should have medicated you with gentle therapy to help balance some of that inflammation in the amygdala, which I call a double gland, and we would try to assist with you with drugs that are not habituating to assist you in that process. That, in combination with what you've learned about detoxification, may not be enough, but it's a basic thing that you should have.
And right diet is really important as well, about decreasing gluten and sugar, just as those are pro-inflammatory as well.
Oh, no gluten. Please don't do gluten. Gluten is, the whole thing with gluten is a social phenomenon, a social marker, because, do you think that millions of people developed celiac disease over 3 years? No, but millions of people have a leaky gut, and gluten, by its very nature, if it's not broken down as it passes the intestinal, through the intestinal cells, provokes quite an inflammation by the immunologic cells sitting right behind it. So that lights up everything. That keeps the fire burning. So no gluten, please. Other folks have certain intolerances of certain food groups. They may have issues with milk. They may have issues with oxalate, issues with sugar, although I'm a little more tolerant with sugar. What sugar does is it spikes the glutamate. If your brain's excited, which it is, it's an excitatory means, so it's going to make you more excited. So if you have bone broth full of glutamate and you whack out, then you can't have glutamine. That may be a problem. If you drink red wine and all the sulfites and you whack out, then you're sulfite sensitive. It's all about the genetics and your ability to methylate and handle the sulfites, the ammonia, and some of the pro-inflammatory issues.
So our next question comes from the UK. It says, I'm from the UK, and the EU president has recently suggested that life is unlikely to return to normal until a vaccine is ready. What's your view on whether this will be safe and/or sensible option for Lyme patients?
That's a really complicated question. So we have 70 companies working on a vaccine. I wish they would work together. Please work together. Everybody's in a race for the finish line and to get the golden goose. We need to work together. And vaccine trials, to be done properly, really take several years. We have a coronavirus we're learning about. It's novel. It has 3 strains, I believe, and we know it's already mutating. We have questions about whether it's going to be seasonal or perennial. We don't know. We have questions about what vaccine is the most appropriate to use and what group is the most appropriate to be immunized. With the flu, since it changes every year, we all have to start over, but if you have hepatitis B, for example, you have antibody, you don't need hepatitis B vaccine. Or hepatitis or any other disease in which you're already immune. We don't know how well we develop immunity against coronavirus or how long it lasts. So we have the issue of multiple strains. We have the issue of we don't know how immunogenic our vaccine is going to be and how long it's going to last and whether it has to be given periodically. We don't know how the serologic tests just being developed, how reliable they're going to be in terms of reassuring us that we have immunity, which should start out as a T-cell based immunity and then eventually to B-cell, plasma cell making antibodies we can measure. Very hard to measure T-cell activity unless you're in a specialty lab. So yeah, we'll have some vaccines, but I'm disappointed. I'm rather disturbed about the fact that we have numerous reports of patients with documented COVID who went through symptoms for a few days or weeks, and then recovered only to be reinfected. Were they reinfected or more likely reactivated? Wonder if they have antibodies. So I don't know how provocative this virus is in terms of creating an immunologic response of any strength and durability. We don't know that. And I think we're going to be using a lot of drugs for therapy until we get our hands around the periodicity of the coronavirus. And then it'll get to almost certainly to high-risk populations who don't really make good antibody responses. And in the Lyme population, unless you, in our view, with experience with other vaccines, unless you are immunocompetent and restored, we're not a big fan of vaccines because you're throwing a big slug of antigen into a immunologic milieu which is just rebuilding and still chaotic. And when you get a big slug of a new antigen vaccine, the effects can be quite adverse. So I don't know. I think it's going to take years and years. My hope is that something bad will happen to the virus and it settles down, but I think that's being a little naive. We have evidence that a few weeks ago it was active in southern Spain, which is their summer, and active in Thailand where it's 90 degrees. That's not good. So we'll just have to see. I do have some hope in some of the chemotherapy that's coming out, and Maybe we do a rotational set when we get a handful of drugs. Maybe we rotate them. The whole idea is to induce immunity and herd immunity, which is a buzzword for everybody. And gosh, I just think that I don't know if that's going to happen, and whether we're going to have to do it every year or every 6 months, or whether they're going to have something durable. So these are questions for everyone to ponder. But as far as the Lyme population, it really depends where you are on the spectrum of care. And unfortunately, we don't have good ways to measure the quantity of the coronavirus, and we'll see about the antibodies. We'll see how good they are coming forth.
Dr. Jemsek, you're getting some good birthday love on the Facebook Live. Lots of people wishing you happy birthday. So y'all keep sending in any comments or any questions that you have, and we'll try to get to those in addition to the ones we already have. So another really popular question is, if I test positive for COVID, what do I do? Do I contact the clinic or?
Absolutely, you contact the clinic if you're our patient, 100%. Let us know. Again, it depends where you are in therapy. If you're in the midst of therapy, we're going to take a time out. I can tell you that. And if you're well into your second year of healing, you're on minimal therapy. You're on 3 days a month of a combination of 3 oral antibodies. Minimal. You've learned how to detox. You're an expert in detoxification and in your own individual way. What works, what doesn't. So it really depends where you are on the spectrum. But if you test positive, and we'll try to help you, by the way, if you're a patient, try to locate whatever region of the country you are, try to locate where the testing centers are, and get that done. And I think it's going to be an evolving concept. There may be additional things that we do for suspected patients prior to return of the swab report, which takes 24 to 72 hours.
Okay, so this next question is kind of a long one. It says, I know that our immune systems are compromised due to LBC, but do certain elements of our treatment weaken the immune system further, such as Daraprim-like protocol? If so, are we putting ourselves at more risk of contracting COVID-19 by continuing heavy treatment at the moment? A few other LMDs have suggested continuing with Lyme treatment, but potentially reducing the amount, strength, dosages at the moment. What's your view on that?
I think that whoever the other LLMDs are, I think that's a very poor approach. You might as well, you're not giving enough therapy to be therapeutic. Your patient is confounded by a virus creating a great deal of inflammation, potentially an inflammatory cytokine storm. You just stop therapy. You stop therapy. And the other question is a very good question, by the way. If you're taking Plaquenil, pyrimethamine, methylene blue, some of the things that we do, you also know that we pulse those, at least for part of the treatment weeks, whether it's 10 days or 14 days. We're giving you 2 weeks off. We're trying to find a balance because we know that all our targets are slow growing. We don't need to treat every day. We also know we create a lot of inflammation by die-off because that's the nature of the pathogen and the damage they've done, but it all has to be manageable. We never keep treating a patient where things become overwhelming or frightening. We never do that. And our programs are built to do systematic killing with a certain progression, with certain targets, always targeting some form of the spirochete, by the way. So your pyrimethamine protocol is probably 10 days. It may be 2 weeks. You have 2 weeks off. If you get infected in the middle of it, we're going to take a time out. What we're doing when we do this, sir, or madam, is we're actually strengthening your immune system. Now remember, you have an overwhelming multifactorial polymicrobial infection that has devastated you, and we're trying to help that. It's immunosuppressed you, and we're trying to help that. And as we get through the program, that's what happens. You become more immunocompetent. It's really amazing to see and very reassuring. So if you don't have a risk to COVID or minimal risk, I wouldn't change a thing. If you've been exposed, as I said earlier, or if you test positive for sure, we take a timeout. We take a couple weeks off, maybe 3 weeks off. We take maybe one small step backwards. We get organized. We identify what problems remain, and we go from there.
And what role do you think safety labs have in all of this? Is it still safe to get safety labs, or is that helpful in regards to knowing if your treatment puts you at increased risk?
Well, I know there's a reluctance to go to the lab and leave the house, but our policy has been whenever we introduce a new drug, we want a safety lab. We want to see if the liver's happy and the bone marrow's happy, and 95% of the time they are. It's just good practice. I would like our patients to ask us on a case-by-case basis whether they can skip the safety lab because either their lab's closed or they're fearful of leaving the house and going with other people. If they would do that, we can look at their history of lab reports, and if there's been an issue, we're going to say, okay, you need to go because there's been an issue. And if not, we might let them skip one, say a month, and just say, okay, fine, you've been good 3 days in a row. We've added one drug this next cycle. Just keep going, but please get it in the month to follow. We feel it's very important. It's responsible medicine.
Another question is, will catching COVID or contracting COVID, does that have the potential to reactivate Lyme borreliosis complex?
Any infectious or stressful event can be a obstacle and a confounding agent for our treatment. We have a list of 25 conditions that either preempt or preclude, I should say, or obstruct any chance for meaningful treatment and recovery. Again, we spend time with our patients beforehand. Many of you know POEMS, that's just the core of it. That's pain, other, meaning support. E is endocrine, M is mood, and S is sleep. And those have to be, let's say, satisfactory. They don't have to be perfect, they can't be perfect. And then there are another 24 conditions that are associated with this disease, which just is incredible in terms of its diversity. And some we know beforehand, hopefully, and we say, no, we have to do this, like we have to take care of this, like you may have moles, or you may have a gallbladder, you may have sphincter roti, you may have this or that or the other, or you may have an atonic bowel and you don't poop. So we're not going to start therapy unless the basic functions are stabilized, or some of these other conditions, of which we have 24, are either found, hopefully they're found or recognized beforehand. Sometimes not. Sometimes they evolve, and we have to take a time out until it's rectified.
And we kind of touched on this question earlier, but we have a viewer from Australia who's wondering, should they get the seasonal flu vaccine because the winter is coming up? What are your thoughts on that?
I don't believe I know the person, so I don't know. I assume they have Lyme, and again, it depends on where they are. We don't recommend the flu vaccine or the zoster vaccine while patients are in therapy, because we've seen it too many times where it really confounds our treatment, perturbs the immune system, which is confused anyway and trying to regenerate. We're not big vaccine fans at that time. We want our, if the flu season's coming along, then you do social distancing, you do the hand washing, everybody's learning. And we're happy to give you a treatment of Tamiflu if you're our patient, or I think there's a new product on the market, and we're happy to do that in the event that you detect very early symptoms of flu, particularly if there's a household member who's documented to be contracted. I'm an infectious disease doctor, and I know that sounds a little bit counter, but we've just seen too much chaos with the flu vaccine, and I'm not against it per se, but I'm against it in our immunocompromised patients where the immune systems tend to be quite chaotic.
And this next question is really interesting. does immunosuppression go away once you get into remission from Lyme disease and co-infections? This viewer, their son is IgG and IgA deficient.
So the answer is clinically, yes, it goes away. It definitely does. People have rashes and vasculitides and joint inflammation, joint changes, neurologic abnormalities that improve. We do very careful clinical examinations. And so we document all these things and we track these things. It's a lot of work, but it's necessary. And so here's the rub, though. Sometimes we'll do a follow-up on the T cell subset, because some of our T cells, anybody knows anything about AIDS, the CD4 counts should be 500. Sometimes our patients are 200. And sometimes the CD8 count, or the suppressor cells, CD4 is the helper, CD8 is the suppressor cell. CD stands for cell differentiation, by the way. So, we see these low numbers and say, oh my God, these people are immunocompromised quantitatively, but they don't act like AIDS patients, so it's interesting. But there's no question they get zoster, they get some other opportunistic things. And there's all sorts of chaotic things that occur throughout the body, through the blood vessels, in the gut, of course, very important. And unfortunately, there's never been a disease like this, folks, in the history of the planet that is so efficient in methodically attacking the central and peripheral nervous system and destroying cells, creating all sorts of inflammation. So I think the question was, do they get better? Yeah, we guide people through. We've guided some very, very sick people through with patients, and then they're teaching us, because patients always teach us, by the way. You know why? You know how they teach us? They teach us because we let them speak. And they teach us because we listen. And we say, huh. And also, patients will bring in information and say, do you know about blah, blah, blah? And they'll say, I've heard of it, but what do you think? And I'll look it up. So we take it as a challenge and get some very, very sick, debilitated, incapacitated people to a state of wellness. And it doesn't get any better than that. And my colleagues here feel the same way. We're all locked in. We know we're doing something very important. And trust me, we get a lot of gratitude, and that's our reward. If you're a doctor, for example, and if you go into medicine, it's to go into health, right? There are a lot of doctors that don't belong in medicine. They should be in plumbing or something else. And the disrespect that doctors show patients these days was never there 15 or 20 years ago. And I think just sign of ignorance and fear, quite honestly, fear. And then some have the illusion of knowledge, which means they think they know everything. And of course, nobody knows everything. And if you know everything, you can't learn anything else, right? So we're happy to say we don't know. We love saying we don't know, but we're going to find out. And if you have a new finding or something we've never heard, we're going to give you a big gold star if it's the truth. Now, don't lie to us, but that does happen, and we learn, and we try to understand, and we research, and sometimes the next week another patient will come in with the same bizarre complaint. That's the second one. That's how you learn. And I'll say later on that this disease should be its own discipline, 100%. Should be its own discipline in medicine. We can talk about that in just a moment.
So recently there was a video of Donald Trump speaking with patients who recovered from COVID, and he made a comment, was kind of talking through Lyme, and that was a very interesting video. But one of our questions that came in was, if you have a certain blood type, can or does this affect getting better from Lyme disease treatment?
I saw Dr. Trump. Sorry. I saw Dr. Trump speaking about this. And St. Tony would jump in. And by the way, Tony Fauci was an incredible steward during the early 80s. I mean, he's an old guy now. And, I'm only 44, but he's old. And he was an incredible steward and kept things together in a very chaotic time with the AIDS epidemic, early 80s through the 90s. Just did a wonderful job of prioritizing initiatives. So he was our go-to guy. So I did that for a long time. I attended a lot of conferences. I presented at international conferences. I did like 70 papers in research. And I am digressing about Dr. Fauci, sorry about that. But he believes a little bit in Lyme now, I think, a little bit, because people have pestered him forever. I'd love to have lunch with him. I'd love to have lunch with Trump. I'd love to have lunch with both of them, because I could break this thing down and make it simple and understandable. There's so many misconceptions. Typo is not a risk factor. I would say Dr. Trump whiffed on that one.
All right, and then there's been news about patients who've recovered from COVID who produce the antibodies donating plasma. Would it be safe for a patient who has had Lyme Disease complex to donate their plasma to help others?
Well, first of all, the Red Cross won't take it. You know, if they're documented you had Lyme, they won't take it. If you just had COVID, I'm not sure what the goal here is. Is it create a IgG pool to give people as passive? I wouldn't touch that with a 10-foot pole. There are all kinds of things circulating in our blood. We are not sterile beings. I'm not interested in anything of the sort. They need to work if they're going to push it. Besides, IVIG is a passive antibody. It just sort of blocks the circulating antigen, but it doesn't eradicate it, and you have to give it every couple of weeks. So it's very expensive, very time-consuming, very laborious, and what we want to do is we want to create an active immune reconstitution. You can't do it giving intravenous immune globulin of any kind.
All right, this next one is a little break from the COVID, but the question is, what is the reason behind alcohol intolerance for those with Lyme disease and co-infections? Does this go away once in remission?
Yeah, so many funny stories about people with advanced neuroborreliosis, lots of inflammation in the brain. Not necessarily, no alcoholics really, but they have a glass of wine or half glass of wine, they're stoned or drunk or hungover for 2 days. So you've got an inflamed brain on fire, you throw a toxin at it. Alcohol is a neurotoxin. Alcohol kills cells, right? And then there's if you don't break down alcohol properly and you're immunocompromised in the gut with the acetaldehyde being formed, then that's an even worse toxin. You may have a monogenetic mutation that doesn't break down alcohol very well. So, but I've seen time and time again, and it's a sign, there are two signs of people getting better that are pretty reliable. One is, well, there are many, many signs, I shouldn't say there are two. Many signs. So one of them is being able to drink without, having unusual hangover or stupor. So that's something that happens several months into therapy. Somebody say, well, can I have a drink? And I'll say, well, you just do a little bit, don't do the hard stuff, just do a tiny bit of wine, and they're able to do it. And to me, that means there's been some repair in the brain and much less inflammation, which that's happened all the time. And people enjoy a glass of wine or half glass of wine, and there's a huge difference after a few months of therapy. The second most reliable sign of the brain healing in our clinic is that the patient can read my writing. And I do a lot of highlighting.
We've got a highlighting budget.
Highlighting here, we have a budget. I have a color for every drug, and I'm consistent with it. It's beautiful.
Mepron's yellow.
Mepron's yellow, artemisinin is green. It's a woody plant. Separate is pink, because when I was a kid, it was like pink suspension that I had to take. Flagel's blue, it makes you blue.
We also recommend, I know I tell my patients, don't drink in Flagyl, so that's an important thing to know. You only have to do it once and then you won't do it again. Sure. So our next question is, do you ever think that Lyme Disease complex will be eradicated? Is that possible?
It's going going to take a lot of work. And it's going to take real dedication, a real multidisciplinary approach. It's going to take some innovation. I don't think any existing universities will do this. We probably see more patients than anybody on the planet, my colleagues and I. I think we're 13,500. We're fortunate now to be able to do some research. We're doing some seminal work with GLA, which will follow. We're doing an economic paper, which will be a protocol for future economic papers on real time, real patients, real data. And we're doing a gallbladder study. I'm doing it with Dr. Trad as a new surgical condition that's never been identified or placed in the textbooks. And we have the opportunity here to do as many studies as we want to if we had the personnel and the money, quite honestly. Because this disease needs to open up. There's so much going on. Do I think it'll be eradicated? I think that, first of all, people have the misconception that when they come to Jemsek, they're going to get an IV, that we're a factory. We're just a mill for IV. Nothing could be further from the truth. We see the sickest people from all around the world. We were a destination practice until COVID, and we will be again. We see patients from numerous international patients who we love seeing, and patients from every state. We understand, I mean, these are obviously they're desperate for care because they have to travel, they may have to lodge, they have to pay us, they have to pay for their prescriptions, and there's just a lot involved. But they'll do it happily because they want out of suffering, they want out of the torture chamber. To eradicate LBC, I had short, intermediate, and long-term goals that I presented 2 or 3 years ago. And I'll just skip down to the golden chalice, if you will, and say this. On the premise that what I do and others do should be its own discipline, because we have millions of people suffering with a multisystemic, multi-compartmental neurologic disease, a polymicrobial disease, and immunosuppressive disease. Nothing like it ever. Scares the hell out of a lot of doctors, and they react in different ways. But that's not the subject. Well, what we need to do is get the appropriate people together, and I'm not worried about money, because if we have leadership and hope and a dream that makes sense, we can do this. But what needs to happen is we need to build a college. We need to have a new discipline, whatever it's called, and we need to have multidisciplinary teaching. We need to have on-hands education. We need to have doctors and other healthcare providers attend, and we need to figure out how to compensate them for leaving work for 4 to 8 weeks. They need to have examinations, they need to be evaluated, and we need to have a method of certification. One of my very good friends here in Northern Virginia, who I'll not name, built his own college some years ago, very successful. So it can be done. And I think the money will flow. People think, oh my God, we've got a real genuine idea here, a real momentum coming. And guess what's going to happen after that? If we get started, some university is going to want to join us. And because you know how it goes. At first they ignore you, then they shun you, and then they join you, or something to that effect. It was accredited to Gandhi, but he didn't say it, somebody else did. But that's what happened. So if we get going, and we actually have a place where we may build near Dulles Airport. So if that can happen, I don't think I'll have any trouble recruiting the best of the best to participate. People with divergent views. It's not going to be the way Jemsek does it necessarily. It's going to be the way it should be done, and we're going to be learning, because there's so much to learn. Our people are sick. The whole society is affected. You think the COVID is bad? We've got millions of people who are decompensated and robbed of their, in the extreme sense, they're robbed of their soul and will to live, quite honestly. We've got caretakers who just can't do it anymore. We've got caretakers who develop tremendous resentment. We have patients that have lost their sense of worth and fulfillment, and it's very sad. But here's the thing, many of those can get better. And a lot of them are sick and debilitated and just limping along, able to go to work, but their quality of life is lousy, and we can help them too. And we usually do that with oral therapy, which is not expensive. It really isn't. And so that's the thing. If you teach patients, if you taught 1,000 doctors how to take care of the basics and learn how to treat Babesia and biofilm and do it in the right sequence, boom. And then with GLA, let's find out what else is going on, because we're going to be working with 3 universities. Let's see what else is going on so we can do it better. Why does Jemsek's protocol work? Let's find out. Let's find out if we can do it better. And I've already told GLA, our patients don't get better until the 5th or 6th month. I've already told GLA I think Babesia is the driver. I've already told GLA that I think everyone is infected with a spirochete. Because once it's in, and it can get in many, many ways. So, oh my gosh, we need better diagnostic techniques, detection techniques, better knowledge of gut health, dysbiosis, vascular disease, control of inflammation, stabilization of brain irregularities, and sleep, pain, psychiatric, on and on and on. So this is what we deal with. My colleagues, Carrie and Kim, Rachel, and Candy, we all know how to do this, and we're learning. It's not, you have to understand, we're learning. So I think being humble is a real benefit to us, and the patients appreciate that. That we know a heck of a lot, probably more than anybody on the planet, but we're humble because we know how much we don't know. And sometimes you see people out there screaming about do this, do that. Run the other way. So much to learn. So that's my dream. It's my dream to build a college, train hundreds of doctors to handle the millions of people who are suffering. Gluten in all the stores, sleep ads by Dave, ad nauseum, better sleep, exercise, infomercials on supplements, from cactus to seaweed. The world doesn't feel good. Explosion of nutraceutical companies combining this, that, and the other, and taking, basic products and just putting them in packages of 3 or 4 different things and saying this is magic. People don't feel good, and they're desperate. I do have something, I guess we're winding it up. Mm-hmm. So I gave I was invited to a lovely conference in UK that Anne Grigson and Natasha Metcalf organized for LDUK, which has about 1,000 members, or 10,000 members, excuse me. It was held in London in June or July last year. It was a day program, so I spoke all morning and all afternoon, and I enjoyed it. Unfortunately, the filming and audio didn't work out, so maybe we could do it again, because I examined a patient, I did a Q&A, and I showed a couple movies, and I broke things up, and I like to do that. And I'm on record that iLabs doesn't like that, so that's why I'm no longer with iLabs and will never be with iLabs. Sorry to get political there a little bit. We're all political people. Look at me, I'm on social media. Oh my God. I'm only 44 years old.
44 again.
Anyway, so we had a back and forth and sent information, and oh my gosh, when we got there, we had this beautiful pamphlet, which has my name on it, but there were other contributors, and they gave me too much credit. This was done, I think, mainly by Anne Gregson. Natasha was dynamo in terms of getting the thing done. I think we had 200 people there, and everybody thoroughly enjoyed it, and I enjoyed it too. I enjoyed telling people the simple truth, things that make sense. And again, it's so easy to do that. It's much easier to do that when you say, I don't know what that is. I haven't seen that. But this pamphlet is about self-help tools to manage LBC, Lyme Borreliosis Complex. Do you realize that 95%, 99% maybe of the people on the planet who are sick and know it can't access decent medical care because there isn't any. And if they can, they can't afford it. So that leaves them out in the cold. So we want to do a very conservative approach, which we're happy to post online. It's not perfect. And so don't criticize it because it was our first try. And I really want to do a second edition with LDUK and maybe in conjunction with GLA or Capital Lyme here with Monty and Greg Skull. But it talks about ways to reduce inflammation and importance of gluten-free, intermittent fasting, which we didn't talk about, but people need to learn about, selective antioxidants, which we didn't go in detail about, diaphoresis, how to sweat, exercise, how to limit in some ways Epsom salt, managing POEMS, which is pain, other, endocrine, mood, and sleep. So see how nice that looks? And it's just really simple, and we're just going to put it on our website, but do not criticize it because it isn't perfect. If you do, we're gonna harpoon you somehow because this is the first time through, but it's pretty good and it's very attractive. And it gets into mental hygiene, it gets into body and mind dynamic, gets into a smoothie. This is my Jemsek smoothie. That they screwed it up, not right.
Culinary art.
Right, culinary art. I invented a smoothie, which is a superfood, controlling histamine, etc. We want to keep it simple. I want to do a second edition, but we're going to put this one on the website, right?
Yeah, I'm going to post it.
Okay, and just as our gift to the general population, as a starting point. Everything's very conservative. We have to have a disclaimer. If you say nasty things about it, we're going to find you and harpoon you. Sorry, I think I've spoken too much. So.
No, that's okay. So we've gotten a ton of great comments and questions. Lots of happy birthday love for Dr. Jemsek for his COVID-19 pandemic birthday, 44 again. So that's been awesome. Continue to post questions and comments afterwards. And again, we're going to try to do this again to kind of go through more questions because we got through a lot, but we didn't even get the tip of the iceberg with it. So we'll do more. So what we're going to do is archive this video for you to reference for those of you who came in a little bit late or whatnot. So we'll post that as well as the pamphlet for reference. Otherwise, stay safe, wash your hands, isolate, do all the things, support your immune system as best as you can and lower stress, all the things that Dr. Jemsek detailed. But we so enjoyed talking with you all today, so thanks for coming.
Thank you for my best birthday ever, and we'll see you soon.